I got back with Israel and stuff.
Okay. Welcome, everyone, to another episode of The Doctors Are In. And if you guys have been working with us for some time, you'll know that we kind of took a hiatus at the end of 2022. We decided to put a pause on this particular program, but we heard a lot of people saying, hey, where are you guys? So we decided to come back. It's at a different time because we wanted to make sure that we were able to have the beautiful, wonderful Dr. Hadar here with us. And so it may be a little earlier than you guys have been accustomed to, but hopefully we'll catch you guys in the recording. Some of you have sent in some of your questions, and we're going to be addressing some of those questions today. In any case, welcome once again to The Doctors Are In. This is a program that is sponsored by It Takes a Village Ministry. I encourage you to go to our website, itavministry.org, so that you can learn about ways that you can become part of a community. It is so essential that as we move forward, we build community. I truly believe that community is the best form of immunity. Community is the best form of getting a phenomenal booster. Not the other stuff, but this stuff is guaranteed to boost your immunity and improve your health and well-being. So join us at It Takes a Village Ministry. In any case, Dr. Hadar, welcome. We are so blessed to have you here with us. How are you today?
Thank you so much, Dr. Michelle. Such an honor to be here again. I appreciate you having me on the show tonight. I'm doing pretty well considering, considering what's going on in the world and Israel and my family is. And I'm just grateful right now. That's all I can say. So thank you.
Our heart goes out to all of those around the world that are in war-torn environments. And Israel is one of those places. And unfortunately, it's not the only place that
unfortunately
millions and millions of people that are waking up every single day, to that kind of environment. Today, one of the first questions that we had for us is we have a 25-year-old male who wrote into us about the fact that he has been dealing with environmental allergies. He had swollen adenoids, and several years ago, he had an operation to remove those adenoids, thinking that that would, alleviate a lot of the issues, but that has not occurred. And so since then, he's continued to take things like antihistamines, and now he's even getting allergy shots, but still he is experiencing symptomology, and he wants to know, what can he do regarding that issue?
Okay.
So throw the ball to you.
So he's 25 years old?
Yes. Young man.
Right, very young. So I always look at the history, right? I always ask, what is the root cause for that? What's leading to that? Is he jabbed with a lot of toxins? Is he eating a lot of dairy? Is he eating non-organic foods that are filled with glyphosate and sprayed with toxins? Is his environment clean? Is he around mold, right? Is he sleeping enough? How is his immune system? If someone has environmental allergies like that, and adenoid issues and tonsils issues and any kinds of ear, nose, throat, any kind of immune issues and allergies, I always look at the root cause. Number one, check the environment you're living in, right? So check, is there mold? Even if you can't see mold, you might smell it, you might not. I would still check to rule out any mold, because mold is extremely toxic and it can lead to a lot of lung issues and a lot of weakened immunity and toxicity. Number two, environmental toxins. What else is around you? What are you using in your home? Are you using any chemicals? Are you spraying, your floors, your kitchen counters, your bathrooms, whatever, with toxic sprays, right? With cleaners that are not organic, that are not clean. So I always look at the environment, and then I look at, what are you eating? Are you eating a lot of dairy? Are you eating a lot of sprayed foods? Are you eating things that are weakening your immunity? And did you get anything injected to your body, right? So vaccines, as we know, will cause a lot of weakened immunity. They will destroy your gut, and they will literally lead to more allergies, whether it's food or environmental. So I would definitely check everything from what's in, on, and around your body, and what has he been doing, and how is his lifestyle? Is he stressed? Is he sleeping? Right? So there's so many things that I would check out to get to the root cause, because you can get all the injections, removing all the organs that are essential, right? You need the organs, you need you need those tonsils, you need the things to help your immune system better. And instead of that, removing and injecting, and look at the root cause. That's what I would recommend.
I definitely agree with you that, unfortunately, we live in a system that wants to just chop everything out of us as soon as the alarm bells go off. But what I have said to many people that you're definitely emphasizing here is your adenoids are like an alarm system, and if you hear the smoke detector go off in your house, you don't go and smash the smoke detector. You say, yo, where's the fire? So, the same thing with your adenoids. They are the detectors, in a way of speaking, for your immune system. And now one of the things that I encourage people to do is to consider doing either an elimination diet or a food sensitivity panel to find out if your body is becoming sensitive to certain foods. And then don't stop there, because if you're sensitive to certain foods, that's not the be all and end all. Meaning, I'm not saying go out and just remove those foods forever and ever. No. Now the problem becomes, well, why did I become sensitive to those foods? And you may have an imbalance within your gut flora that led to a lot of inflammation, that led to what we call, quote unquote, leaky gut. And because of that leaky gut, you had food particles going past that and starting to overstimulate or over trigger the immune system. So as you were saying, Dr. Hadar, definitely to do a deep dive and always ask, well, why? Always ask the question why until you find an answer that is rooted in something that you can change. When you find an answer that is something that you can change, you're on the right track. Awesome.
Yeah, 100%. And then definitely nourish, once you remove and find out what's the root cause, nourish your gut, strengthen your gut with probiotics, with sauerkraut, with foods that have probiotics in them, right? And prebiotics. And food. Take your lung support supplements, right? Take your zinc, take your D, your K, your NAC. So take stuff to help support your immune system from the gut and the lungs to help support.
Awesome. So now you guys who are here live with us, please feel free to either unmute yourself, raise your hand, and or put questions into the chat, okay? Because that way we're going to be able to respond to what your concerns are. And if you are here live, you take priority over any of the questions that were emailed to us. So please, please, please be sure to send in, questions here for us to address. All righty. Okay. So let me check and see if we have any questions so far. All righty. Okay. Now, another question that came in to us was regarding one of our senior citizens. So we're going from one end of the spectrum to the next. So we started out with the young folk, and now we're going to our senior citizen. We had a concerned son who was writing in regarding his mom, and his mom was recently told that she needed to take medications to be able to thin her blood, having to do, and this was kind of because they were talking about her having to deal with a heart issue. And so the question became, well, why are we taking this medication that has to do with a blood thinner? So do you have any thoughts on that?
Yeah. So did she get the COVID vaccine? Do you know the background of that?
I do not know.
So it depends on what the condition is. But if she's microclotting, if she did take the COVID vaccine, she can possibly microclot. So you want to definitely be on blood thinners, or better yet, the spike support, which has the nattokinase, which is much safer and much better for microclots. than blood thinners that I'm not, a huge fan of. So it depends on the heart condition. I'm not a cardiologist. I don't know her history. I don't know what's going on. I don't know what led her, like, what is the condition of the heart? What are the doctors seeing? I haven't seen her blood work, so I can't give that medical advice because I don't have all of the information that I need to in order for me to actually be able to shine a better light on that.
But
That
I
makes
love
sense.
what you're saying, which is that, one of the reasons why I'm so excited about having you here is because you are one of the functional medicine doctors with the wellness company. And the wellness company is now giving you the opportunity to be able to get a second opinion. So
Right.
instead of trying to figure everything else for yourself, and I'll be the first to tell you, Michelle knows absolutely nothing about medications other than what she reads on WebMD. Okay. So that is not my forte. I kind of take a back seat and leave it to the pros like Dr. Hadar and all the other functional medicine doctors that are part of the wellness company. But this is where we are getting the opportunity to start to ask ourselves, when we are in the medical office with our doctor, do we have the ability to get informed consent? Or should I say to give informed consent? And to me, I will make a blanket statement that 9 times out of 10, we are not in a position to give informed consent because we don't know what we don't know. And unfortunately, a lot of the medical doctors are not able to tell us about alternatives. And unfortunately, a lot of times they don't tell us about possible side effects and consequences to taking these different things. And so for me personally, I get really heebie-jeebie when I hear about our senior citizens taking blood thinners, because I want to know, well, were the tests done? Did they have any kind of test that would lead us to believe that there was any kind of clotting? Like, let's look at the fibrinogen. Let's look at, whether or not there are other inflammatory cascades that are happening that would make you say, yeah, let's put this person on a blood thinner. Because my fear is that if you don't have those particular issues going on and they're just giving you this medication because it's preventative, just in case, something like that happens. But if you, God forbid, bump up against the sofa a certain way, or, you go in for another procedure and they nick something and you're just bleeding and bleeding and bleeding because you can't clot. I don't know. Like I said, it gives me the heebie-jeebies. What are your thoughts?
Exactly. No, 100%. You always have to run the blood tests and look at what is going on with the patient before prescribing any medications, especially blood thinners as well, because you can easily internally bleed as well. So you really just can't throw in blood thinners. What I would recommend as a holistic practitioner and doctor, get on foods that can thin your blood naturally, right? So anti-inflammatory, like turmeric or curcumin, which is the active ingredient in turmeric, right? Flavonoids, right? Grapes, like eat your green leafy vegetables as well. Get your chlorophyll. So get your greens, get your turmeric, combined with cayenne or pepper to activate it. Get your vitamin C. Vitamin C is not only great as a blood thinner, but it's great for your immune support. It's great for your adrenals. It's great for so many things. So you might as well take something that is preventative and that has benefits in every aspect, and instead of medications that can be harmful and dangerous. And get on nattokinase, get on our spike support, especially if you have those conditions. You don't want to get on regular blood thinners. This is so much safer and better and preventative as well. So highly recommend that. That's
and the beauty of what you're recommending is that those particular natural elements are not stopping the clotting mechanism of the body, but rather they're stopping what would trigger the clotting. So they're helping the body to deal with inflammation, deal with oxidation, and all of those things that would make the body want to create clotting.
Right.
But it's not interfering with the actual clotting mechanism of the body. So if, God forbid, like I said, you get into another scrape, and, our senior citizens, they tend to have like really thin skin, like paper thin skin, the slightest little thing will bruise them or cause them to start to bleed. So if that were to happen, your normal clotting mechanism would activate. It wouldn't be sabotaged by the medications that they're giving you, and plus, bonus, these things that Dr. Hadar is telling you about with the turmeric and the vitamin C and all of these things, they will help your body to heal. So,
Exactly.
I mean, it's just a win as far as I'm concerned, But again,
100%.
I think one of the first things is to be able to know what are the right questions to ask our providers so that we can put them on notice that, wait a minute, I'm paying attention and you haven't really given me the reasoning that I need to say, yes, let's go for this. And the reason why I'm saying that this is so important also, the other part of the story that I forgot to mention is that this poor older woman, after insurance, the medication costs her $250
You're kidding.
a month, yes, for like 14 pills. And how many senior citizens do you know of that can afford $250 prescription for one medication? Because it's not like they're on just one medication. Usually they're on like 2, 3, 4, 5 medications, right?
Exactly.
And this is after the insurance. This money has to be dealt out for this particular prescription.
That's pissing me off. It's crazy. That's really not okay. And the thing is, unfortunately, with a lot of doctors, they are making bank off of prescribing medications. That's how they are being, subsidized, right? That's how they're making the money. So unfortunately, they keep shoving and pushing medications without even looking at risk factors. Does the person really need it? What are the side effects? Nothing. And they won't obviously go recommend a supplement or nutrition because they're not trained in that, nor can they really. But if I were the medical doctor, I would actually look at the root cause. That's what I do. And does she actually need to have that? Has she run the blood test? Like, there's so many questions here. So if I were that patient, I would ask for a second opinion. I wouldn't get that medication. I would look at who else can she talk to, like myself or another doctor, right? That can really treat the root cause, look at what else she's taking, give her alternatives, and run the full panels to really see, does she need that?
Awesome. Okay. All righty, you guys. I don't see any questions yet in the chat. Come on. Let's get some questions going. Hold on. Let's see.
Hi, this is Tony. I can ask a question.
Absolutely, please.
Okay, Dr. Hadar, Dr. Gamble. I know this person that got gout. He is in his 60s and he got it about, say, 8 years ago. And I know him personally because when I look in the mirror, I see him. But I think the cause was, when he was out camping, he ate like 1.5 pounds of bacon. This is no kidding. I did that because I was cooking and all that. And you know how bad that is. I mean, I was in an RV then. In order to go to the bathroom, I had to crawl. Couldn't do that. Now I'm on, I think it's allopurinol, and it has helped. I know I can get it, on my feet and all that, because when I try different things, I can feel it coming up, and basically it happens in my toes. My question is, and I've heard of, somebody told me beets is good for it and something like that. And I'm on a low dose of allopurinol. I'm not sure how effective that is, but I'm living fine now. I have no issues, but I have to stay away from anything with nitrites. But luckily, they got the no nitrite bacon. Perfect, no problem. But if I eat stuff with nitrite, I'm sensitive. So, what are my options? And like I said, I'm on allopurinol, and I'm okay. But I do have to watch what I eat. I love red wine. Guess what? I can't even smell it. So it's got to be, white wine or just sparkling wine. So that's the track I'm on, allopurinol daily. Any alternatives?
Yes.
There
Can I
is?
answer
Oh,
this?
no.
Can I answer this? Well, you're not going to like what I have to say, especially if you like meat and pork. Are you ready?
Yes.
Okay. So you're
Can
sitting.
you handle the truth?
Go
ahead, Doctor.
I eat some red meat, but it's not rare, but it's like only once a week type thing. And I don't eat full portions now. And I do drink a heck of a lot of water when I do that. So that's.
All righty. Okay, so here.
Don't smile at me, young lady, please.
I will always smile.
I want an answer. No, okay.
I'll smile. So here's the deal. Gout is obviously the result of purine, which comes from certain foods that are mostly acidic, right? So acidity will lead to gout as well, mostly. Animal byproducts, heavy doses of pork, meat, certain vegetables will do that. Unfortunately, because of oxalates or lectins, they can have that. So what I recommend is, number one, cut all the pork. Doesn't matter whether you have nitrates, whatever it is. Pork is extremely toxic. It is not a healthy food. It is extremely acidic. Anything that is acidic will lower your pH in your body, and your blood will lead to gout and other arthritic conditions and other issues, right? So you want to go more on a plants in a sense of green leafy vegetables. I'm not saying spinach or kale. I'm saying like arugula, chard, collard greens, celery, lots of lemon water, things that alkalize your blood and cleanse your liver more will behoove you to eat and use instead of masking the symptoms with the medications you're on. Because, that can also harm your kidneys, that can harm, your bones, your arthritis down the road. There's so many conditions that can be caused because of a highly acidic diet, which is what you're dealing with right now. So get on the alkaline wagon, as I say. Get more of the lemon water. Lemon is acidic, but once it enters your bloodstream, it's extremely alkaline. Lemon and lime. Drink your chlorophyll, eat your green leafy vegetables, avoid the spinach and kale as much as possible, not completely, but don't eat them as much. But eat your greens. You can definitely do some wild fish. I wouldn't recommend so much of the meat. And if you do, cut back and do wild, organic, grass-fed, whatever it is. Just make sure it's organic, whatever you're doing, and grass-fed, plant-based mostly, lemon water, green leafies, clean diet, exercise, all that stuff. Because what you've been doing so far sounds extremely acidic and toxic, and that's why you're dealing with gout and problems like that. I hope that helps.
Well,
and make sure you drink clean water, like purified, alkaline, reverse osmosis, and then you can throw some lemon or lime or Himalayan salt in there.
Okay. Well, I do work out while I walk a lot, and I also haven't eaten pork in quite a while, but I do enjoy my stay awake heavy. Okay.
How old are you?
I am 66.
Okay. Just be mindful.
Thank you. Okay, will do.
And another thing to consider, along the lines of the detoxification that Dr. Hadar had mentioned, is sometimes when I have people that are dealing with gout or just high nitrates in the body, to do what we call a water flush with distilled water. And that can be like a 1-day flush, so if you're getting, say, an attack, to help the body with distilled water, because the distilled water will pull all of that stuff out of the system. However, caveat, do not drink distilled water on a regular basis. Do not do that, because it'll start to pull all of the minerals out of your body, which you do not want to happen. So It is something that is done for just a day to try and get all of the excess out of the body because of that emergency crisis situation. And then, you may want to consider doing it, say, for instance, the first drink in the morning to be distilled water, just to flush out the system. But then after that, making sure that you're drinking ordinary water, and definitely putting in chlorophyll. You can get liquid chlorophyll to add to your drink, as well as the lemon and the lime that Dr. Hadar was talking about. So just some other things to do, and also to consider what are the other things that you may be consuming that is contributing to the acidity of the body. So one of the major contributors to the acidity of the body is sugar and carbohydrates, you know? And so when we have those bouts with the gout, it may not be just because of that food. That food may have been the last straw that broke the camel's back, but that acidic environment has been building up and has been maintained for a long time, and that's just taking you over that hump. And one last thing is getting a very good quality probiotic, because your probiotics will help you to break down some of the purines and some of the oxalates, you know. So getting a very good quality probiotic and making sure that the diversity in the gut is hospitable to the bacteria that will help you to break down those certain elements. All right.
Yeah, 100%. I agree with you. And I don't know if you carry any lines of supplements, but I have great supplements for probiotics and other supplements that are very helpful and quality. So if anyone needs, let me know.
Yeah, absolutely. So, you know, what you can do is you can always go to our website, itabministry.org, and look for the Doctors RN, and you'll see Dr. Hadar's profile. And on there is a link that you can click on to communicate with her directly. And in our chat, we have the link for the wellness company that you can always contact the wellness company to get that second opinion that we keep talking about. Because the more you are empowered with information, the better your conversations will go with your primary care provider or any of your healthcare providers, you know, to let them know, put them on notice, hey, I'm getting a second opinion. I hear what you're saying, but I'm getting a second opinion. And when you say that, they kind of straighten up and they start to look at you differently, because they know that you're not just a pushover. So I'm definitely
Love it. And we have another question here in the chat.
Fair enough. Thank you.
Yeah, you're welcome. Thank you, Dr. Michelle. Great answers too.
Okay, so we have another question here. Do you recommend detoxing for spike proteins and other environmental toxins that we are exposed to? And if so, what kind of detoxes do you recommend?
Yes, definitely detoxing from the spike protein, and we have the spike support product for adult and kids. So I highly recommend for that, taking that for the spike dissolving and to help your body get rid of the spike protein. I always recommend, I'm a big detox girl. When I lived in California, my website used to be called SoCal Detox Doc. Now it's the Vibrant Glow, because I knew I was going to get out of California and move to Florida. So I'm all about detoxing the liver, the lymphatics, the kidneys, the lungs, the gut, the bowels, like everything, every day doing something.
Yeah.
So I'm a big proponent of supplementation, sauna, sweating, and I have detoxes that I do for patients and supplements that I give and provide for environmental toxins, for detoxing, because our liver can only handle so much. Yes, our liver detoxes, but we are bombarded from the spraying in the sky, from the environmental toxins that you're inhaling when you're in your home or outside, from gasoline, from wherever you are, and from whatever you're consuming. And unfortunately, we cannot control what we inhale and where we are. And even when we eat out, that it's going to be organic, usually it's not, unfortunately. So you really have to constantly detox and help your liver and help your body and help your lymphatic system and your bowels and everything to cleanse daily. It's crucial.
Yes, absolutely. I love.
Hold on one second. Usually when I know what I know about cleanses, it's like, you might cleanse, 1 week, every month or something like that. But you say do things, I guess it's smaller things daily.
Yeah. So
Yeah.
regularly, whether it's, and let me give you examples. Make sure you have your bowel movement every day, right?
No
And have a
problem
good bowel
there.
movement every day. Make sure you sweat every day. And if you can't exercise or can't sweat while exercise, go sit in a sauna, whether it's infrared sauna or regular sauna, and make sure you drip sweat. Sweating is huge to detox. Make sure you take supplements on a regular basis, whether it's glutathione, which is a master of all antioxidants, like vitamin C, NAC, milk thistle, and other liver, gallbladder botanicals that can help with detoxing. Make sure you also cleanse your gut from parasites, right? And candida. Make sure you cleanse your lymphatics, especially because a lot of people have sluggish lymphatic systems. So there are different formulas. I carry all these supplements and formulas for lymphatics, for liver, for gut, for everything. So make sure you, on a regular basis, you can do daily things. And once in a while, you can do parasite cleanse. You can do a more gallbladder, liver, comprehensive cleanse. So make sure you stick to regular detoxing daily. And then once in a while, every few months, do the parasites, the liver, gallbladder, the lymphatics. Highly recommend it and highly urge everyone to do that. Absolutely.
I love the fact that you're emphasizing that detoxification is an everyday occurrence. You know, the reality is that every single moment of the day, your body is detoxifying. The question just becomes, how much attention do you pay to it, and how much do you support that detoxification process? And so even something as simple as breath work. And I know you're just like, Michelle, what are you talking about? Well, guess what? You release the majority of your toxins through your breath. Do you realize that? Pounds of toxicity are released through your breath. That is why during the past 3 years, when people were going crazy with the face coverings, I said, how could you do that? You know, it was like so counterintuitive to me. You know, why would I want to prevent my body from releasing toxicity when we're going through that quote unquote concern with our immunity? The worst thing to do to your immune system is to clog up your detoxification pathways. So breath work, I encourage you to really do research in terms of optimizing your breath. And then things like skin brushing, you know, releasing the dead skills from your dead cells from your skin so that your skin can breathe. Your skin is the largest organ in your body. And a lot of times when we're breaking out and we have pimples and things of that, and all we do is we cake on all kinds of other stuff that is preventing our body from releasing that toxicity, you know. And as you said, drinking that water. One of the best ways of detoxifying your body is through water and through adding things like the lemon to help to invigorate the colon, you know. And then you can start to get even more, you know, psychedelic, if you want to call it, and think about things like enemas, you know, think about things like castor oil packs, think about and movement, massage, lymphatic massage, or even doing what we call lymphatic drainage, which is, you know, just brushing your body and moving it towards the lymph nodes. And you can learn a lot about that on YouTube, so I won't even go into that. But all of these things accelerate your detoxification process and movement. And I'm going to throw something juicy into the mix that you guys are going to be like, oh, I'm going to say it. You ready for this? Ready? Sex.
Ready. Yes. Yes. And you know why sex is so good? Sorry, I'm just going to say it.
Go for it, Hadar.
I will, but I'm going to just say it. Having an orgasm moves your liver, chi, and blood, and it releases so many good chemicals, and it moves your everything, and it makes you happy. So definitely, if you're not having sex, go take care of yourself. I'm just going to say it out loud. I'm a big proponent of that.
I don't know about you, but after that, I get the best bowel movements. I tell you, everything's like whoosh.
Because you moved your liver chi, your liver. Yeah. So here's the deal with liver. Your liver in Chinese medicine is the organ that wants to flow smoothly, right? If your liver is stagnant, your blood is stagnant. The liver holds and stores blood. So if you're not exercising, if you're angry, if you're not eating clean, if you're not detoxing, your liver is not moving smoothly. So you get all these emotions, you get constipated, you get cranky, you get whatever. Sex, orgasms, exercise, detoxing are excellent for your liver. They're excellent to move everything. So definitely do that. Go have sex with someone you love. Don't just go have sex and don't be promiscuous, right? Go have sex with someone you like. Go take care of yourself. Go do those things because they're important and they're healthy.
But I love that you even brought up, the connection to the emotions, because a lot of times when people talk about detoxification programs, they don't really address emotional and mental detoxification. And I'm here to tell you, you can take as many liver potions and pills and herbs, but if you do not address the congestion in your heart, the congestion in your mind, the congestion in your soul, you've just wasted your money. I'm just going to tell you that. You've just wasted your money.
100%.
Because if you're going to hold on to those negative, or should I say depleting emotions like anger and jealousy, and all of those things, they are going to tighten up your liver so it cannot function. It's going to do the same thing with fear. If you're going to hold on to fear of the future, anxiety, whatever it is, that is going to strangle your kidneys. And that's another very important organ when it comes to detoxification, and even to the gout issue. If your kidney is compromised and it's not filtering properly, it's being overworked or overtaxed, that can lead to a buildup of these metabolites that would give you the symptomology of gout. So then we can even talk about, blood purifiers like red clover and things of that nature. And dandelion and all of these wonderful bitter herbs. Yeah, your core bitter herbs for your liver also, so whether it be, oh gosh, there are countless ones, but your bitter herbs, those are the ones that you go for. Those are the ones that are going to help your liver chi and help you to purify your blood more effectively.
100%. I love it. Absolutely love this topic. It's so important. Yes. And then dry brushing. And I have to give you an example. So of emotions and skin and detoxing and sweating and stuff. So I was let me backtrack. In the last 2.5 weeks, since the whole Israel thing, my whole family's in Israel, I have been completely consumed, sad, devastated, scared. And then I was traveling to London for about 8 days. So I was surrounded by people who were completely vaccinated and everything. I was exercising not enough, and it was so bloody cold, as the Brits say, that I couldn't sweat enough, right? And I'm used to sweating every day a lot. Sauna, exercising here in Florida. I love sweating. It's so important. My skin is usually flawless. I came back home, even though I exercised a few times, I wasn't sweating enough. And I started breaking out, and I had a little chest cold. I still do. My emotions. So a few things contributing to that. Number one, not sweating enough. Even though I had my detox pills and I had my supplements and I still took them, I didn't sweat enough. My skin started to break out, and I was like, what is going on? The skies in London were sprayed non-stop. I was shocked. The air was not clean. Even though it was so cold, it was definitely not clean. The environment, right? The foods were pretty clean, and I ate vegetables like none of them were really organic. I don't think they spray it like they do here. But I came back, immediately started sweating in the sauna, felt immediately better. My skin cleared up again, like everything's so much better. But also the emotions, because I was so sad and scared. I have such PTSD from what I've seen. It's not even funny. Like I couldn't sleep at night. I threw up. Like I had such a horrible emotional trauma, still do, from all these, that your lungs, so every emotion affects your organs. Your lungs are affected by sadness. Your kidneys are affected by fear, right? Your spleen is affected by worry, right? Your Every organ is, your heart is by joy, liver by anger. So there's every emotion will affect our organs. So I also urge you, anyone listening to it, pay attention to your emotions. If you're sad, be with that and then release. Try and release as much as possible. Easier said than done, but definitely pay attention to those emotions. If you're fearing, take, adrenal support, take things and work on your fear and substitute that for love and safety or whatever you can do to support that. So there's so many connections from Chinese medicine, 5 elements as well, for emotions and organs and how they manifest. Big time.
Yeah.
Yeah.
It's very important to always approach health from a holistic standpoint. And what I share with people is we need to put the holy back into health. That's really what health is about. Health is about becoming whole. And whatever you are challenged with at any point in time, always ask the question, what is it teaching me about my health journey? What is the lesson that I need to learn? Sometimes the lesson is physical, sometimes it's emotional, sometimes it's mental, sometimes it's spiritual, sometimes it's a combination of all 3 or 2 or more of those things. But always address the whole and not just simply look at creating a Band-Aid for the problem, right?
Yeah. Yeah. I see Tony's question. Dry brushing.
Skin brushing? Yeah.
So
dry brushing.
So you can take a brush, which is a body brush, and start literally brushing your skin every day towards your heart to stimulate your lymphatic drainage and flow. What I use every day in the shower is an Israeli loofah, which is so hard, and you just scrub your skin and makes it so soft and supple. I love it. And that's my dry brushing. So I literally go from the legs up, right? Up in the buttock, in the legs, back, chest, armpits, right? So people who say, I'm trying to use natural deodorants, but I stink. And I'm like, well, are you scrubbing your armpits? Are you getting off the dead skin, the bacteria on there? Make sure you do that with dry brushing or a loofah in the shower or anyhow, to get rid of the dead skin and the bacteria, because that's what makes you smell, right? You can take chlorophyll and all that, but dry brushing is great for lymphatic drainage. Get a brush, get a loofah, do it in the shower, do it bare skin, or with oil, however you like. It will be great for anyone and everyone.
I love that you mentioned the loofah because I just have a bumper crop of loofah. My second harvest in my garden were loofah pods. And so this is my first year and they're huge.
Love
So
it.
right now I finished harvesting them and now they're drying out so that I can get the actual loofah. And it's absolutely phenomenal. Absolutely phenomenal.
That's fantastic. You're welcome.
Yeah, it's not it's not rubbing yourself with your dry hand. Although, that does help what's called the lymphatic drainage, because lymphatic drainage is a very light type of massage. It's not like your deep tissue massage that are trying to deal with the muscles. Lymphatic drainage is very, very light, a light touch, because that's all that's needed to actually stimulate the lymphatic system. And another phenomenal thing to help you with your lymphatic flow is rebounding. Yes. You know how our children just love to jump. Well, that's why they have optimal lymphatic systems. They're always moving like little jack-in-the-boxes. So rebound, and you don't need to get one of those rebounders. You can just, rebound on your tippy toes down. And if you want, you can get one of those small little trampolines, but that rebounding action will help to stimulate the lymphatic system in the body, because unlike the cardiovascular system, the lymphatic system does not have a pump. Subsequently, the only way your lymph will move is if you move. Okay, that's it. So one way or the other, either you're going to have somebody move you for you, so this is especially true if you have, say, a family member that is in the hospital that may be bedridden. Be sure to do things like a lymphatic brushing, a skin brushing, to help that person's lymphatic system, so that all of the toxicity that's being released from the cells that go into the lymphatic system are being able to leave the building. Otherwise, it just kind of circulates and they just sit there just fermenting and putrefying in their own filth, their own internal filth, which is so horrible that we do this to people, but it happens, you know. So you can be that saving grace for your loved ones.
Love it. Excellent.
All right. Do we have any other questions? Feel free to enter it either in the chat or you can unmute yourself and ask any question that you wish. Did you have a question, Jenna?
Yes, I just want some suggestions on, let's see, pretty much I'm looking for either a myofascial, I guess I need an expert direction of where to go. I don't have a lot of really good therapists. I was in a very bad car wreck about 1 year and 2 months ago, and I'm still having trouble with my knee and putting full weight on my leg. And I'm trying to keep it in motion. I do a lot of vibration and I do a lot of other things, red light therapy and such. But I think the guy that put the splint on me in the ER, he didn't put it on correctly. So now I have a knock knee. And so I found I'm doing all these fascial summit experts, and I found out that the bones will conform to the soft tissue, the fascia, the tendons. They can be shaped. So I've been using castor oil and massaging and trying to lengthen the IT band to get my shin not to be poking towards the outside, but to be aligned better. And they kind of strangled my foot in the, well, it wasn't a cast, it was a very tightly wound splint. I've only been under these incompetent people twice in my life. I had my 3 babies at home with midwives. But every time I've had an accident, they do a lot of really strange things that leave me with results. So I've heard that myofascial, and then people keep trying to get me to a chiropractor, but I know there's different levels of chiropractic. And because I'm so in pain, I'm kind of emotionally guarding that knee and the foot, but especially the knee. And the thought of somebody trying to align it or mess with it, touch it and try to correct it is like, So I'm wondering, what kind of therapist would you go to see or look up? I might have to travel to Chicago. I'm 2 hours in the country out of Chicago. So I don't know. I just need a few suggestions.
Okay. If I may, really quickly, I don't live in Chicago, so I wouldn't know, but I do recommend a chiropractor because you want to align your hips, not just your knee, because a lot of it, oftentimes in accidents and stuff, it's not just the knee, it usually comes from hips that will affect the knees as well. So definitely see a chiropractor.
Mm-hmm.
I wish I could recommend one. I don't really know anyone in Chicago, but I would ask around and recommend, ask around for someone who's good and gentle. Acupuncture as well. So acupuncture and chiropractic are the 2 things that I would highly recommend.
Okay.
Myofascial is great, but definitely acupuncture and chiropractic would behoove you, or that's what I would go for. That's always what I've used my whole life, my whole adult life at least. And I'm an athlete. I have many injuries. I've treated myself and I've gone to chiros and I swear by them. So that's what I recommend. And I'm sure
now there's different kinds of chiropractic, and there's the old-fashioned back crunchers, and then there's the more gentle ones. What do you suggest?
All chiropractors study the same, different methods, different patients. I still recommend the adjustments and more gentle, but they go by patients. So everyone is different. So I don't know what chiropractors would be there, but I recommend looking it up. And seeing who might be the best. PT as well with active release, ART. So, and I can type it down. So it's PT with ART. Anyone who does ART or anyone certified in ART, which is active release therapy. A lot of chiropractors do that too. Chiro and Acu. These are the things I would recommend.
And also, Jenna, I will give you my email address if you can contact me, because I have a body technician that I always send my clients to whenever they have these types of structural issues. And he's able to look at your alignment and look at how you are standing and give you exercises and things of that nature that will help you to bring those structures back into alignment and to give you the musculature that will support those structures staying in alignment. Because I understand your concern about chiropractics, because sometimes they don't address the long-standing issue, which is what is going to help me to maintain the proper alignment. It's one thing if you do snap, crackle, and pop, and I feel better for like 5 seconds, but you know, will I stay that way? So that is why I usually have people work with, his name is Stanley Dietrich, and he is phenomenal. He works with a lot of athletes. He works with a lot of people that I've been recommending to him, and just phenomenal. And he's a beautiful, beautiful person. So I'm going to send you my email address. And if you send me an email, I'll definitely get you in contact with him. And as I said, he'll be able to look at how you're aligned, you know, because he's going to have you take pictures of different areas so that you can see exactly what is happening. And then he'll be able to share with you different exercises that you can use to strengthen your alignment and to maintain it. So that's another option. Hey, Dr. Alejandra, ¿qué pasó?
Hi, I'm sorry I couldn't make it on time. I had a lot of things going on with my kids today, so I'm sorry.
It's okay. We've been on for almost an hour. Yeah. I have to hop off shortly too.
Yeah, so we're almost about to wrap it up.
Yes.
But we had a couple of questions that we dealt with, which were allergies and gout. So would you like to give us a little...
You're breaking out completely. I cannot hear a thing.
Uh-oh. Can you hear me now?
I can hear you now.
Okay. So I said that our main topics that we dealt with today were gout and allergies. And I was wondering, Dr. Alejandra, if you would be able to contribute on either one or both of those topics from a homeopathic perspective.
Sure, thank you. So of course, there are specific treatments on homeopathy for allergies, depending on the symptoms that you have, and also gout. And gout, I think that it's better to treat it on the nutritional way, of course, because if you take away the meat and you take pineapple, for example, that is going to help a lot to diminish the uric acid on the body. So I would attack first with the diet and then with a homeopathic remedy. And yes, on the allergy side, of course, if it's on the skin, rashes, if it's on your runny nose, of course, we have specific treatments. But remember, there's no one treatment for allergies. It depends on the symptoms everybody expresses.
Awesome. So yeah, we did not catch that one, Dr. Hadar. I forgot all about pineapple being really good for the gout issue. Thank you.
Yeah,
see, I tell you, 3 heads are better than 2.
Always.
Also, so pineapple was good. Okay. I'm like, I eat a lot of pineapple and it's fresh, but the initial thought I got when you said was stay away from it. But I'm like, okay.
No, it's really good for you. It's good for a lot of things. It's also, I mean, bromelain is great.
The bromelain in there. Yeah. And that's what's isn't that in the spike formula, the bromelain?
They're putting that in addition. So they're bringing the bromelain and the curcumin in addition to the spike support. So yeah. Mhm.
Awesome, awesome. Well, my ladies and gents, I want to thank you for joining us today. And of course, we have my ma'am, Sophia, who always has to be a part of every single show. And so
cute.
we want to thank you on behalf of It Takes a Village Ministry. Thank you for joining us for our session of The Doctors Are In. And we encourage you to like and subscribe, but most importantly, bring your loved one next time, or your friends or your family members, so that we can help to have that conversations that you may not feel comfortable with having with your medical providers. Bring those questions to us, bring those concerns to us. And if anything, if you cannot be here with us in person, then just email us those questions and we'll be sure to address those questions. And we will send you a link to the recording if you aren't able to be here in person. In any case, once again, thank you for joining us today. And we look forward to seeing you